Hospice UK, I don't know if many people have heard of Hospice UK, but it's a kind of national organisation, national charity for hospice and end-of-life care. This is our kind of strapline. We work to ensure that everyone affected by death, dying and bereavement gets the care and support they need when they need it. We are a member organisation, so we've got 210 members at the moment of non-NHS hospices that joined to become one of our members. We have policy teams, comms teams, governance, patient safety teams like myself, and volunteer teams. So there's various different teams, but we are quite a small organisation. But that's Hospice UK. So just today we have been invited to talk about Every Action Counts, which was a project that NHS and I looked at back in 2020, I think it was. You're probably all familiar with it. Yeah, there's a few nods in the room, that's brilliant. So we came on board to look at making it relevant for hospice care. Every Action Counts is very much about behaviour. So those of you in the Symmetry workshop before will have heard about behaviour change. It's very much about behaviour being driven by several factors and how it can influence and make people act the way they do. We used insight from frontline staff, patients, professional bodies, and using clinical communication and IPC experts to really focus on what could be done to support everybody, including our patients, to achieve excellence with our IPC. And the outcome was to have a suite of co-designed projects developed to address the key themes. I think this is me again, isn't it? So Every Action Counts was a principle was based on supporting behaviour, enabling everyone to be leaders and involving our patients in a project along with all our members of staff. Every Action Counts is aimed at keeping the need for infection prevention and control, keeping our excellence at those levels. As we've heard this morning, people can dip in and out of the excellent behaviours. The research stressed the importance of communicating with groups such as our patients and our members of staff through a variety of different formats and channels to reinforce expected behaviours, to constantly send out that message. Situational reminders in key areas were considered to remind people in the moment, and this includes thinking about the location, like staff breaks, having TV rolling screens in changing areas and that kind of thing. It was really about creating the conditions and the environment to make excellence and IPC happen when it could.
But, so I think the challenges for hospices are, even just reflecting on people in the room, the way that hospices are actually supported for IPC is a big challenge for the hospice sector. So what we do know with hospices is that they are often supported from IPC from a variety of backgrounds. So their IPC lead may actually only be a registered nurse, a Band 5 registered nurse with very little IPC experience and very little experience in risk assessment or IPC expertise. And then the expertise would come from a contract or just a relationship that we would have across the IPC sector. That could come from a hospital, for example, it could come from a community, it could come from the council. And so for hospices, it's really, really challenging to know where to get your expertise and where to get your guidance, because hospices aren't care homes and they aren't hospitals. And so we were really keen as an IPC team to actually look at the Every Action Counts work and make it work for hospices, because we're very individualised in what we are, and actually each hospice is different in its own setup and network. So just to talk you through how we meet and collaborate as an IPC team. We currently work with the ECHO project, which Julia's going to talk to us about.
That's right.
Yep.
So Project ECHO, has anybody heard of ECHO technology? Yes, there's a few nods. It's a global technology that was started, I think, in New Mexico when practitioners were looking to have some best practice around about their hepatitis C care. And they brought people together using technology to share and learn from each other. It's one of our kind of enablers, as I've said, that we use across a lot of different communities of practice and groups in Hospice UK and with our colleagues in Northern Ireland. It's a great technology. So it really is about all teach, all learn. It's fundamental kind of QI methodology. We bring people together via video conference. We have an expert speaker and then some case studies that are shared with the group. The group chooses the curriculum, the group chooses what they want to learn, the group chooses how and what they want to hear and who they want to hear from. So it's very, very much about collaboration. So that is one of our key drivers that we've been using in Hospice UK to get that learning out there and to get, as Anne said, all the different hospices on board with the guidance and the behaviours. We had our IPC curriculum setting meeting last week, so we had all the hospices were invited to give us what they wanted for the coming year, how often they want the sessions, what time of day they want the sessions, and we use a thing called the VVox poll, which is a kind of automated poll that we do live on the session, so then people can choose actually what they want and they can like. And so the thing that has the greatest likes is the thing that we'll focus on for the first meeting, which is going to be in May. So it's a brilliant technology and very much used in Hospice UK, but also globally across the world.
So what we went from was a face-to-face meeting which was focused in London, and our IPC met just twice a year. And it was a real challenge, particularly if you were an IPC lead living in Glasgow, for example. It was a big enterprise to come down to spend that time. And so what this ECHO project enabled us to do was actually meet with the 120 hospices, invite them, and we could actually look in real time, in real work time space, to be able to meet and share practice. And so what you can see on the slide here is that in 2020 and 2021, when the COVID pandemic hit us, we were meeting, there was just above 200 people that were meeting at any one time, 2019, but that really increased over the pandemic. What we also had was that we wanted to meet more regularly. So rather than just twice a year, we were actually meeting every other month to work together to look at the challenges. And as you're all aware, I mean, it was a very challenging time for all of us, but particularly in the hospice sector where you could be quite isolated, quite alone, and feel abandoned by NHS supplies, for example, that suddenly you were able to get your supplies from NHS supplies, the pandemic hit, and suddenly they've been your supplier for 20 years, you couldn't get your PPE anywhere. So it was a real challenging for us hospices, and this IPC network was a really good way of actually meeting and sharing practice together.
Yeah, so it's around about the kind of behaviours at Every Action Count, was around about behaviours, but also Project ECHO is also kind of around about behaviours of sharing, learning, supporting.
And developing ourselves, yeah.
But also just to point out that it's very cost effective, it's very inclusive and very responsive, so we could respond quickly to the guidance that was changing every Friday afternoon. So this is a big thank you. So with the Every Action Counts, we'd met as an IPC team in the ECHO, and we actually then had a working group of us that volunteered to look at the Every Action Counts sort of work, what was going on. And so a big thank you to all of these hospices that took part in the working group. So what did we do? There was an opportunity for us to align the IPC tools and to look at them across the hospice sector. And we wanted to look at what we could achieve with them. So we reviewed and read and explored the tools and the documents, and we tested out the following. So we looked at the checklist monitoring tool for the management of COVID-19, and we looked at whether that was workable for hospices and whether we needed to make any adaptations to that. We particularly looked at the assessment tool for COVID-19 outbreak vulnerability, and actually, as a working stream group, we found that particularly useful for us as a team, and it actually enabled us to look at our vulnerabilities and was a very good focus for us.
We also wanted to test a couple of these videos, and we'll show you a slide of what they look like shortly. But we wanted to test these videos, which were part of the Every Action Counts, which was challenging people's behaviour. And that wasn't just staff behaviour, it was also around visitor and volunteer behaviour. And so we tested those, and we wanted to look at the impact and the reliability. And we tested those using a variety of methodologies, and particularly we used SurveyMonkey. And so actually people in the hospice sector had an opportunity to go onto the SurveyMonkey and evaluate whether these tools were useful or not. And we did that across staff groups. We interviewed some patient and families, and we also interviewed volunteers, which was particularly important for hospices because actually we use a lot of volunteers to support our service. So we looked at those tools. So the next slide just gives you a reminder of these videos. I'm sure you probably they spring to mind, and how useful they were. And I think particularly with our volunteer and staff groups, they were very useful to help us challenge behaviours, because particularly if you're a lower grade member of staff, a cleaner or a volunteer, it helped you challenge other staff members when they were maybe not doing practice, or to help us understand practices about why we should eat separately, for example.
So this is just a slide just with a link. I'm sure the slides are being sent out afterwards, and they'll be available. But this just to say that Hospice UK now hosts the tools for hospices. So anybody that wants to look at them from a hospice perspective, feel free to look at our website. But I also just want to point out that the project started in June 21 and was completed by November 21. And that is a big thanks to these guys in the hospices who worked their socks off to get these tools tested and went through the quality improvement cycle. So just, again, it's due to these guys.
Okay, so a double act here. So key messages really was every action counts, and each action you take has a really big impact. And I think that's particularly important for hospices to recognise that actually we are we're small organisations, but actually we're supporting people at end of life, and that has a big impact across the country. And so small actions are important, and we were able to support people to die with people having their relatives at the bedside, and that was really important for people not to die alone. The project focused on particular levels of behaviour, and a component of the project was how we looked at that as a network. And really, we wanted to raise the profile of hospices across the UK, and that's really important talking in a conference like this, that actually people understand that hospices, care homes and the primary care team have a really important factor to influence IPC standards of practice, and we need to adapt and look at those. It's not just things happening in hospital, it's across the community that we need to look at, and everybody has their own individual needs. And so that was really important that we were able to work at a national level to have influence on those tools. So language is key, and leadership is key. And I think it's really important to remember that we all play an important part of leading IPC in the future, and hospices need to be involved in the future of IPC. We're all in it together.
So this is just a link of the resources which we've briefly touched on before. So you'll find it on the Every Action Counts. If you Google put that into Google, you'll find that. And it's got the toolkit, it's got the checklist, it's got the tools, hints and tips, the role descriptor, and the videos that Anne's mentioned. And again, the resources I imagine will be sent out after today. And just as a kind of final round-up, just want to say again, thank you to the hospices that were involved. They met, they did the work, they used their quality improvement, and they produced the tools that they needed to produce in the midst of a pandemic and in the midst of caring for their patients. So again, thanks to Anne and her colleagues.